Hi, and welcome to week 2. It was really nice to get to meet all of you through the welcome forum, and I was excited to see you all engaging with your classmates. I hope that your semester is off to a great start, and if you have any confusion at all about this class at any point, reach out to me at my email, POBR, that's PEOBR, at mooresville.edu. I'm also available in Shannon Hall throughout the week, either in my office, which is 108, or on the massage therapy side of Shannon Hall. If I'm not in there, I'm probably in one of the classrooms. My office hours are on Tuesdays from 9 to noon this semester, but a lot of times I'm there until 1 o'clock anyways on Tuesdays if you ever just want to pop in and see me. And also, with that being said, this course only runs for 5 weeks. You have an option at the end to do the hands-on portion, so you can become American Heart Association certified with your basic lifesaver certification. And that will happen sometime in that first week of March, right before you guys go off to spring break. So I will post some days that you are able to do that later this week. So stay tuned for that and sign up if any of those dates work for you. And if those times don't work for you, reach out, let me know, and we'll figure out a different time. So welcome to week 2. Again, if you want to do the hands-on certification, that part is optional. You can still pass this course without it. But if you'd like to do it, it's an additional $8, and you will set up a time with me to practice the hands-on portion of this class. And then you take a short, oh no, sorry, you don't take the written exam. You take that online already. Okay, so hopefully some of those times work for you if that's something you're interested in. And if not, let me know. We'll figure out a better time. So let's get right into it. Hopefully you've had time to go through all of the videos that I've shared with you so far. They're going to be really helpful. And just as a reminder, here are some of the basics: EMS, emergency medical services. We also need to decide when to provide first aid. So if you are just taking this course without doing the hands-on certification, you are not technically certified in first aid. So you do not ever have to give first aid in general. Even if you were certified in first aid, it's up to you whether or not you want to perform first aid unless your job requires it of you. So there might be an example where you're a licensed medical provider, such as a nurse, such as a doctor, and you have an obligation to act in those emergency situations. It also might be that your job requires you to do it. So maybe you're a personal trainer and part of your job duties is to act if somebody needs first aid. But that's just while you're on the work site. When you're walking down the street or something like that, it's up to you whether or not you decide to provide first aid. We always want to get consent, though, from the victim, whether they say yes or no, or they're unable to let you know. Then, as we talked last week, you would still give them first aid if they're unable to communicate it, because a normal person in normal circumstances would want the first aid. So example, they're unconscious, they're not breathing, they're unable to respond to you. That's when we would still give them first aid. If they say no, we need to respect that and do what you deem necessary to get them help if they do really need it, but you need to step back. And then with them saying yes, you would properly go through, introduce yourself, let them know you're trained in first aid, and then give help. And we did talk quite a bit in the last video too about first aid kit and just making sure that you always replace what's in there, what's been used, and that they're in appropriate locations. And then keep in mind, the New York State has Good Samaritan laws that protect you in the event that you harm somebody while giving first aid to a certain extent. So say, for example, you give first aid and you're giving CPR and you crack somebody's sternum because of your compression. They cannot then turn around and sue you because you were giving effective CPR that saved their life but cracked their sternum. So we have those laws here in New York State. Each state is going to vary by state whether or not they protect you in that sense. But don't ever not act because you're afraid somebody's going to sue you because you're pretty well protected here. There are examples though where if you're being negligent, for example, we suspect a head or neck injury, but you move the victim because you don't want to give CPR in the mud and then they end up having more damage because you move them when you already knew that they had a head and neck injury. And that's one of the things we'll discuss, like we don't move somebody when it's the case. So if negligence is there, the Good Samaritan laws might not protect you, but overall, when you're trying to help, you can rest assured that they're there to prevent you from being sued. So some of the key steps to first aid, we're always assessing the scene, looking around, making sure that there's no danger for us or the ill or injured person. And if there is, how do we avoid it? Are there other people around to help us? Who is injured and how many people are injured or ill? Because those are things that we need to know when it comes to getting help. And where exactly are we? And you think about it too, like how would an ambulance get to the location or other emergency response vehicles to be able to describe that in case there's like barriers, blockades, or out in the woods, it's at school and it's during like school drop-off time, like is there a better route and all that. So as you phone for help, you will always follow dispatcher's instructions and also our universal precautions. So things like washing our hands, protecting our eyes, wearing gloves, wearing personal protective equipment, and just making sure that we stay safe as well, washing our hands after the incident. We can help find the problem by using medical jewelry, looking for medical jewelry. So a lot of times if somebody does have a chronic condition like low blood sugar or they have a heart condition, they will be wearing a medical bracelet or necklace to identify them and what their medical problem is and maybe even how to remedy that. And always, 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 we're protecting the person's privacy. So whatever happens, we keep private. We don't discuss with anybody unless it is a work supervisor, police officer who's writing up a report, a work-related report. Those are times when it's okay. And then also if you need some help, guidance, counseling afterwards, you can speak to a licensed therapist or grief counselor or somebody if you need help. That is totally okay because that's also in a private setting. So I highly recommend going through and doing the questions in your workbook on pages 18 and 19. These are going to be helpful when it comes to taking your exam at the end of week 3. We're going to briefly go through medical emergencies like breathing problems, choking, allergic reactions, heart attack, fainting, diabetes or low blood sugar, stroke, seizures, and using an epinephrine pen. So breathing problems can be mild or severe. If they are mild, that's usually not going to be life-threatening. More severe is when we see the life-threatening issues persist. If somebody is having heart attack, stroke, they could also experience breathing problems simultaneously. You can look on page 22 for different types and varieties of asthma. And asthma is disease of the air passages. somebody's having an asthma attack, they will have trouble breathing. This also ranges from mild to severe. When it comes to choking, you can see the universal choking sign on page 25. This is, again, mild to severe, and never just do a blind sweep where you stick your finger into somebody's mouth to try to get out an object they're choking on. Typically, we see this example with like parents or caregivers and their children, where they're choking on something and they just stick their finger down without looking to try to push something out of the way. That can actually make it worse. We don't want to grab for an object unless we can see it and know we can get it out. If you do the hands-on portion of this course, we will learn how to do removing an object. We'll also do like Heimlich maneuver while you are doing the hands-on portion. When it comes to allergic reactions, oh, sorry, let me just step back. So when it comes to choking and we want to get the airway back opened up again, you would then do the maneuver in order to remove the object, especially if you can't see it. If you are able to see it and you can grab it, it's always better to do it with a gloved hand. If it is your kid, even if you can get a glove on your hand, awesome. But in an emergency situation, you might not be able to, but you definitely want to wash your hands afterwards. And then just keep in mind, if you are trying to remove the object, it doesn't remove, and then they become unconscious and they need CPR. The difference here is we're going to make sure that we're looking each time in between sets of compressions for that object to have surfaced in their mouth. So we'll talk more about how to give CPR in the subsequent weeks, but that's just something to keep in mind if they are choking on an object. When it comes to allergic reactions, we can also have mild or severe. I have some of the common allergic reaction items listed here. Page 30 gives you a really good idea of different signs and symptoms, whether they're mild or severe. And an epinephrine pen is a prescribed drug that can help stop a severe allergic reaction. There's spring activated or electronic, super sharp needle that's able to go through your jeans, your pants, in the side of your thigh. Page 31 gives a great example of that. And so if somebody gives you permission and you're trained in first aid and CPR, you're certified, you are able to give this epinephrine shot to them. If they're able to do it, let them do it themselves. But depending on the person, they might not want to give it to themselves. After the shot is administered, you'd want to stay with the victim, get them further medical attention because it's a small dose. And depending on how much of the exposure they've had, they might need more hospital attention. So stay with them. And if things don't get better within the next 15 minutes or so, get them to the hospital. If you want to err on the side of caution, get them to the hospital regardless. And when it comes to disposal, you're going to want to make sure that that needle gets in a sharps container or gets to the hospital or in the ambulance with the victim, so that way nobody is hurt by a sharp needle. Heart attack is the leading cause of death in the world. Sudden cardiac arrest is when we have abnormal heart rhythm and the blood is no longer pumping to the vital organs, and death with it occurs within minutes if the victim doesn't get help. With heart attack, this is where blood flow, part of the heart muscle, is blocked by a clot. So we'll see like chest pain here in one or both arms, sometimes in the neck or jaw in between the shoulders. And what you're going to want to do for that, check out page 34. It gives some more in-depth options, but we need to call 911, get the victim help. They can even chew on an aspirin in the time that the ambulance is waiting to arrive. And this is another one where we need to get them help right away. If the person does become unconscious, we would check for breathing and pulse and then activate CPR if necessary. Fainting is usually over a short period of time. Somebody passes out and they usually become dizzy, unresponsive, and it occurs and all of that happens in less than a minute. If they do not wake back up after the minute, they're unresponsive, call 911. But if the fainting occurs and they are able to get back up, help that person lie flat on the floor, and just elevate their legs, help get that blood flow going back up, and then slowly they can stand up. It should be something that is reported as far as a medical goes, but if they get up and they're feeling better, it's not really considered an emergency anymore unless they become unresponsive, or they don't improve. But it is something that should be documented. They should tell their doctor about it because there could be an underlying issue occurring. With diabetes and low blood sugar, this is when diabetes is when there's low levels of sugar in the blood. And so some people take medications such as insulin to help maintain their sugar levels. But somebody else can have low blood sugar without having diabetes. So say it's been like a while since you ate something, or like you were dehydrated, puked, had diarrhea, things like that, that can actually create low blood sugar as well. So this can also happen if somebody has diabetes and they've inserted too much insulin through their injections. So signs would be irritable or confused, hungry, thirsty, weak, sleepy, sweaty. In some cases, they can even have a seizure. So you can check out in the book for more options, but ultimately we want to get that person sugar, and it needs to be real sugar, packet of sugar, candy bars, soda, juice, fruit, honey. It can't be a sugar substitute like Splenda or a Diet Coke or something that says sugar-free on it. We need to make sure they're getting their sugar. And you can check out the other steps to action in case things don't get better on page 35. With a stroke, think of the acronym FAST: facial drooping, arm weakness, speech difficulty, and time to call 911. So blood stops flowing to certain parts of the brain, whether there's like a blockage or a leak, and this is a medical emergency that needs to be acted on right away. So call 911, stay with the victim until further help arrives, and always give CPR if the person becomes unresponsive. As far as seizures go, this is when we have abnormal activity in the brain. Most seizures stop within a few minutes, and they're caused by a medical condition called epilepsy. But they can also be caused by head injuries, low blood sugar, heat-related, poisoning, sudden cardiac arrest, things like that too. So if you haven't seen somebody have a seizure before, it can be really scary to witness it. They lose muscle control. They usually drop to the ground and have jerking movements in other parts of the body. And they stop responding. But not all seizures look like that, though. Sometimes somebody can be completely still as one happens and you wouldn't even really know. So that that can be difficult to determine. We want to just make caution for the person having the seizure. So like get any objects out of the way, kind of move tables or sharp edges on things. You can always put their head under a pillow, but we kind of just like let them have the seizure and then respond afterwards. So this is going to just be determined on the individual person. If there's somebody who's never had a seizure before, they're unaware of it in their medical history, we're calling 911, we're getting them to the hospital. If this is something that's happened, they might have a protocol in place. So that would be something you would talk about with them or their caregiver. And you can also check out more options on page 37. And on page 38, you have some more example questions. So we're moving right along here with injury emergencies, which look like external bleeding, wounds, internal bleeding, head, neck, and spinal injuries, broken bones, and sprains. burns and electrical injuries, and also when we need to control bleeding by pressure and splinting. So you'll get hands-on examples of those two in the certification hands-on part. When it comes to dressing and bandage, think of like your gauze and dressing and gauze are simultaneously used. It's a clean material used directly on the wound, and the bandage is going to help protect and cover that dressing and cover the injured body part. It also helps increase pressure, which is good for helping stopping the bleeding. And so you can check out on page 40 and 41, external bleeding. Losing large amounts of blood can also cause the body to go into shock. Shock can happen for other reasons too, like you get into a car accident, you have like some really jarring news, things like that. But if you lose a lot of blood, your body can also go into shock. And if it does, we want to get the person laying down, cover their head with like a blanket, but make sure they can still breathe. So just like the top of their head, lose a lot of heat that way through our head. And then we're also going to want to elevate our feet up on a box or something at least 12 inches, because this will help increase blood flow throughout the body. So that's what we want to do if the person goes in to shock. Shock can kind of look like delirium. They don't know what's going on. They might start to turn really pale, shaking, cold. So if that's the case and we're suspecting shock, we want to get their legs elevated, top of their head covered, stay with them. If they don't get better and the bleeding doesn't stop, they might need some medical intervention. If they're bleeding from the nose or mouth, have them handle it themselves if they're able with a gloved hand. If not, you're going to definitely want to put a glove on and help them out. So with the nose, we're going to apply pressure and lean forward. We never lean back with a nosebleed. That's how we end up with like blood in our eyes and down our throat. And with the mouth, apply constant pressure and address any breathing problems if there are any. When it comes to tooth injuries, when they become broken, loose, or knocked out, you can look on page 46 for some different options that you can use when it comes to how to preserve a tooth. But we can use like whole milk, coconut water, and get that tooth right away with them, either to the hospital or emergency dental services. Eye injuries too can happen through a direct hit or chemical. We want to deal with those injuries according to what's happened. Page 48 is a great resource, and it shows you too, if you get a chemical injury and you're going to rinse that out of your eye, you always want to make sure the affected eye is on the bottom. So that way when you're rinsing out your eye, you don't then end up with the chemical in the unaffected eye. And you can check out more on the first aid kit on page 77. I also highly recommend you taking a look at environmental injuries like our chemical or poison exposure, animal bites, and insects. And you can find more about that in the YouTube video that I've posted with all of the examples. So good luck, and let me know if you have any questions on any of this information.